dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamahalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan din ng kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan!
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies, government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic Research Portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socio-economic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan diin ang kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan.
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies. Government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic Research Portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socioeconomic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Welcome to the PIDS webinar series. Before we start our virtual event, we have some reminders. For attendees, your microphone is automatically muted upon entry. If you wish to join the discussion, click the Q&A icon, type your question, and click Send. For Facebook viewers, you may send your question using the comment section. Remember to keep your questions concise and direct to the point. We will screen all questions to ensure that they are relevant to the webinar topic and the presentation. The moderator will read the questions during the open forum and cover as many as possible depending on the available time. This webinar is being recorded and live streamed on the PIDS and SERPI Facebook pages. The recording will also be made publicly available on the PIDS YouTube channel. Thank you for joining us, and we look forward to your active participation.
Good afternoon, everyone. Welcome to the SERPI Knowledge Sharing Forum with the theme Nourishing Our Future Through Food Security and Nutrition. We are thrilled to have you here for this insightful and engaging virtual event made possible by the Socioeconomic Research Portal for the Philippines, or SERPI, and the Philippine Institute for Development Studies. I am Ezekiel Nicomedes, the SERPI Project Coordinator, and I am honored to be your host for this afternoon. SERPI is an initiative of PIDS that started 22 years ago to serve as a common link between the government and research institutions in establishing an open repository of socioeconomic information. And we are proud to say that SERPI is the country's first online repository of socioeconomic information. Currently, the SERPI network has more than 60 partner institutions, mostly from the government and academia, bonded by a shared passion for research, knowledge, and exchange. This virtual forum is one of the SERPI's efforts to help partner institutions disseminate their knowledge outputs, strengthen research networking within the network, and promote SERPI as a platform for evidence-based discussion of current and emerging development issues. For the fifth installment of Knowledge Sharing Series, we will put on the spotlight in support of World Food Day on October 16. This afternoon's webinar will discuss multifaceted issues of malnutrition and its intersection with food security and human development. To formally open our event and offer us a glimpse into the topics that lie ahead, let us listen to the opening remarks of Dr. Aniceto Orbeta Jr., the PIDS president.
Good afternoon, everyone, and welcome to our virtual forum on the theme Nourishing Our Future Through Food Security and Nutrition. Let me start by acknowledging the following officials who took the time from their busy schedules to join us today. Department of Budget and Management Assistant Secretary Gerardo Maula, Senate Executive Director Diana Lynn Cruz, Development Academy of the Philippines Director Nika Saliendres, COL Foundation Executive Director Ramon Emmanuel Dereje, University of San Carlos Department of Economics Chairperson Julius Silapagos, USC Department of Nutrition and Dietetics Chairperson Layan Cormanes, USC Office of Population Studies Foundation Director Nanette Mayol, East-West Seed Foundation Executive Director Maria Elena Bantoren, Unang Hakbang Foundation President Uli Lucas, and Bulacan State University Vice Chancellor for Instruction, Research, and Extension, Cecilia Hieronimo. I would also like to greet the various representatives from the government, academia, private sector, civil society, and media present today, and those watching through the PIDS and SERPI Facebook pages. I welcome you to this fifth virtual forum organized by our Socioeconomic Research Portal of the Philippines Project, or SERPI. In support of the World Food Day, we are devoting this webinar to discussing multifaceted issues of malnutrition, its intersection with food security and human development, and how we can address those challenges guided by the studies conducted by some of our SERPI partner institutions. Food security and malnutrition have become pressing issues in many countries. A recent report by the United Nations Food and Agriculture Organization revealed that in 2022, 2.4 billion people, accounting for almost 30% of the world population, lack sufficient access to food, with around 900 million suffering from severe food insecurity. From 2020 to 2022, almost 51 million Filipinos face moderate or severe food insecurity, ranking the highest in Southeast Asia. These statistics highlight the urgent need to address food-related challenges in our region. Securing affordable and nutritious food for all, especially for the most vulnerable, remains a significant challenge in our country. The COVID-19 pandemic exacerbated this challenge substantially. According to the PIDS Economic Policy Monitor 2020-2021, the pandemic increased the transportation costs and prices of specific fresh foods. This escalation was primarily due to the intermittent mobility restrictions impacting million Filipinos. At present, even though the World Health Organization already declared that COVID-19 is no longer a public health emergency of international concern, Filipino families still find it challenging to afford food items due to inflation. This reality can lead to people eating less food and in some cases, choosing less healthy and lower quality options, which may affect workers' productivity and students' school performance and exacerbate malnutrition. A World Bank report places the Philippines fifth in the East Asia and Pacific region with the highest prevalence of stunting and among the world's top 10 countries with most stunted children. Solving this nutrition crisis is important because it hampers children's development, affects school performance and future productivity, and can potentially alleviate the burden on our healthcare system. This afternoon's presentation will help us understand these challenges and explore policy solutions for enhancing the country's food and nutrition governance. I want to thank the SERPI partner institutions and their presenters participating today. We have Dr. Martis Chonko of the De La Salle University School of Economics and the Congressional Policy and Budget Research Department, who will present her study on food prices and their impact on food and nutrition security. Dr. Mary Janet Arnado of the DLSU Social Development Research Center will discuss the assessment of maternal, newborn, child health, and nutrition health systems for indigenous cultural communities in the selected United Nations Children's Fund or UNICEF areas. And our very own research fellow at PIDS, Dr. Barley Gilbert Olip, who will talk about the determinants of socioeconomic inequality and the trajectory of child stunting in the Philippines. And Professor Giovanni Stanley Malab, the Marianos Marcos State University, who will talk about biointensive gardening for schools and households in Batac City, Ilocos Norte. To all our Zoom and Facebook Live participants, thank you for spending your Thursday afternoon with us. Let us participate in today's discussion by listening to the presentations with an open and inquiring mind. Let us not hesitate to ask questions and share our ideas as well. In conclusion, let us dedicate ourselves to fostering a future in which subsequent generations inherit a nation where food is accessible to all and the well-being is universally enjoyed. I give back the floor to our MC, Seki.
Maraming salamat, Dr. Urbeta. At this point, I would like to invite Dr. Sheila, our speakers for this webinar, Dr. Val Ulep, Dr. Tionko, and Professor Malab for a quick photo opportunity. Our platform host, Sasa, will assist us. Sasa, please.
Thank you, Zeki. Hi, everyone. May we request to open your camera? And the team will spotlight you as all. All right, hold on. Is Dr. All right. Okay. Please hold your smiles as I count to 3. 1, 2, 3. Okay, one more. 1, 2, 3. Thank you so much.
Thank you very much, Sasa. I know we are all excited to hear the presentations, but before that, let's direct our focus to the screen for our webinar poll question of the day. So our webinar poll question for today is, what is the leading cause of malnutrition and food insecurity in the Philippines? Or in Filipino, ano ang pangunahing sanhi ng malnutrition at kakulangan ng pagkain sa Pilipinas? To participate, Simply scan the QR code on your screen or click the provided link in the chat box. This poll is open not only to our Zoom attendees, but also to our friends joining us via Facebook Live. So I invite everyone to participate by simply scanning the QR code on the screen or clicking the link sa ating chat box sa Zoom chat box or sa Facebook comments section. Can we now show the results, please? Now let's take a look at the results of the Mentimeter. Sasa, please. Okay, so we have 23 responses. So what is the leading cause of malnutrition and food insecurity? Nangunguna dito ang poverty. We can also see food insecurity. We have inflation. We have scarcity of goods, extreme hunger, lack of resources, and what else? Lack of food production. Pero ang nangunguna sa ating word cloud ay ang poverty o ang kahirapan. No? So, thank you very much for participating into this our short effort to engage our participants. To kick off our presenter introduction and moderate the upcoming discussion in open forum, I'd like to invite the PIDS Department Manager of Research Information and SERPI Project Manager, Dr. Sheila Siar. Dr. Sheila, the virtual floor is yours.
Thank you very much, Zeki, for your excellent hosting of our opening program. Good afternoon, everyone, and it is my pleasure to be here with you today to moderate our conversation. And thank you also for participating in our webinar poll. Malalaman natin, matatakal natin yung mga sinagot nyo mamaya sa ating conversation at ang mga ito ay maaari ding masagot sa mga presentations ng ating mga speakers. Okay? So without further ado, let us start our conversation, and to kick off our discussion is a presentation tackling the impact of food prices and food security and nutrition. And I just recalled one of the answers dun sa ating poll kanina, inflation, no? And this presentation is a very timely topic as food prices, as we all know, these days have gone through the roof, making food, especially nutritious food, less accessible to our low-income groups. And this has exacerbated the already serious problem of malnutrition in the country. Our presenter is Dr. Marites M. Tionco, who is a professor and former dean of the De La Salle University School of Economics. She obtained her Bachelor of Science in Applied Mathematics and Master of Science and Doctor of Philosophy in Agricultural Economics from the University of the Philippines, Los Baños. Dr. Tess' research work focuses on human capital development, including gender issues, poverty and inequality, and the economics of agricultural development, with emphasis on critical natural resources and policy issues affecting food security, food and water safety along the value chain, market access of smallholder crop and livestock producers, agricultural health and productivity, climate change mitigation and adaptation, and environmental sustainability. Before joining the LSU, she was a research fellow of the Markets, Trade, and Institutions Division of the International Food Policy Research. Dr. Tionco is also currently connected with the Congressional Policy and Budget Research Department of the House of Representatives as a Congressional Research Fellow. Dr. Tionco, the floor is now yours.
Thank you very much, Dr. Sheila Shiar. Nice to see you again after a long time.
Likewise, ma'am.
Good afternoon, everyone. Thank you also to all the participants joining us via Zoom and FB Live. And I'd like to thank also Sir P. Pids for inviting us to present our preliminary work in support of the World Food Day. So again, I am Marites Tionco, one of the researchers of the House of Representatives and Ateneo Center for Economic Research and Development's project on evidence-based research project. So you can see the authors on the screen, and together with us from De La Salle University. We have, of course, researchers from the Congressional Policy and Budget Research Department, and headed by the Executive Director Manuel Aquino and Director Rosemary Sawali. And so may I now go to the next slide? Okay, just a little bit of background. So this is actually this project came about in support of the 8-point economic agenda in preserving the purchasing power and food security. So this is one of the 8-point agenda of the current administration. And the GAA allots around 174 billion pesos towards the agriculture sector, most of which would support the Department of Agriculture. And also this is anchored in the Philippine Development Plan 2023-2028, where it aims for the provision of a sufficient and stable supply of food and commodities through boosting the productivity of agriculture, fishing, and forestry sector. So we know that the PDP also targets a food inflation rate of 2% for 2024 to 2028, which is a far cry from the soaring food inflation that we have, or that we are currently experiencing. Okay. So that's the data as of September 2023. Year on year, we have 8.2% of inflation. And among these food groups, actually, the main contributors are vegetables, fish and seafoods, meat, and cereal products. Okay, next slide, please. Excuse me. Just to give you a brief background of the objectives of this project or of this study, one of the main objective is to help the policymakers and how they can effectively intervene in the agricultural sector to ensure food security and preserve households' purchasing power when it comes to food and agricultural goods. So we came up with several questions. One of them is, how do high food prices contribute to overall inflation, and how do they threaten food security? And with that, also nutrition security. And one of the objectives is to determine the impacts of high food prices and price risk on households and on food and nutrition security, as well as determine and explain the factors contributing to high food prices in the country. So through this study, we would like to answer those questions. Next slide, please. And making sure that we link the food security and poverty alleviation problem with the nutrition security and the escalating food prices that could result to malnutrition and related socioeconomic issues. Next slide, please. So just to let you know that our study is not done yet, so this is a work in progress. We are using this conceptual framework to better understand or to come up with the answers to the questions that I raised earlier. So we are guided by this conceptual framework, wherein we came up with these 3 factors that would be contributing to high food prices, and we categorize the factors into 3 groups. We have lack of agri-food system approach or value chain approach, and then legislative constraints and institutional constraints. So the lack of agri-food system or the value chain approach would include the production and market constraints. So under the production constraints, you can see the barriers that are listed in your screen. I hope you can see them. These are decreased efficiency, increase in the cost of production, and so on. Market constraints would also include the shifts in consumer preferences, the quantity demanded, the quantity of commodities demanded, and also the quality of food consumed. So included in the legislative constraints would be the barriers to food supply and food production, and also the restrictions on land ownership, being the prominent example, which is what we are still experiencing up to now. And then, of course, the high tarification and tariff barriers also that's directly affects our food prices. So lastly, the institutional constraints. This includes, of course, the barriers in governance and policy. So don't worry, I won't be discussing all of them. I'm just showing you the conceptual framework that guided us through the study. So next slide, please. So the following slides will be some facts that probably some of you already know, and I'm just going to show them here. To your upper left, sorry, there, okay. Now I have the pointer. So to your upper left here, you can see that there's a sharp increase in the value and volume of Philippine rice imports from 2016 to 2019. And then you can, I'm sorry, I think it's very small letters, no? Small fonts. So by 2020, you see a significant decline in volume of rice production, but slightly increase in the last year. So somehow there's some fluctuations in terms of rice production. And next to that, this one here, you see that based on July 2023 trade data, compared to last year's July 2022 trade data, there was a decline from 291,000 metric tons this year. Which declined because last year it was 434,000 metric tons, and there was 33% decline in rice imports. Over here, you can see the lower left, based on Philippine Statistics Authority data, the retail price in the country for well-milled and regular milled commercial increased from August to September, which we experienced lately, and the same is true for the farm gate prices of palay from July to August here. Okay, so due to the rising retail prices for rice, which is our staple, we eat a lot of rice. No, that's our staple food. We are aware that the president has signed Executive Order 39 to provide a price cap or price ceiling on rice to up to 41 pesos per kilo for regular milled rice and 45 pesos per kilo for well-milled rice. And it was also lifted a few days ago. So these two categories account for approximately 90% of the rice market, the well-milled and the regular milled rice. Okay. So the last graph here, the bar graph, shows you the rice stock inventory as of July 2023, which was estimated at 1.8 million metric tons. And it has exhibited a decline of 0.8% from June and 11.3% compared to last year. So as of July 2023, rice stock at 54.6%. Were from commercial sector, rice stock inventory of the household sector also, and from NFA depository. But this has stocks have decreased by 14.3% for the household sector stocks, and NFA stocks has declined by 28.5%. So the commercial stocks rose by 16.1%. We consider a year-on-year change. So from 2022 to 2023, in terms of the year-on-year change on rice stock inventory of the household sector and NFA depository, there was a decrease by 28.7 and 62.1% respectively. So the next slide that you see on your screen is actually a historical price data on where India is dominating the world market for rice. Why I'm showing India? Because lately India has stopped its exports of rice, right? And so, well, India is considered a big economy or a big player when it comes to rice. So it affects the world price of rice, and its trade activity can affect the world trade and, as I said, the price of rice. So India dominates the world market, exporting an average of 34.6% of the total exports of rice during the last two to 3 years. Next slide, please. Okay, sorry again, these are, but I'll just explain to you the graph that you're seeing now. It's the share in Philippine rice imports. So we all know that rice, the Philippines is the number one importer of rice. So while India dominates the world market, we don't get much of our imports from India. And 80% of our rice supply or our rice imports comes from Vietnam and some from Thailand. The Philippines is more directly affected by the movements in Vietnam supply, trade, and prices. You can probably recall during 2008 when that happened, when Vietnam and I think India also has stopped the exporting rice as well. And so we already know what happened then. So we had to import, nagpanic tayo, no? We had to import a lot of rice way back then. Okay, next slide. So more on historical point of view. So the world price of rice, if you can see here on the graph, has actually steadily increased. And that's the reason why we had supply shortages, and also because of the Russia-Ukraine war and other events that have affected the rice supply chain. So it's not only the shock from the Russian-Ukraine war, but somehow the India's recent rice export ban might have also affected our Philippine rice prices. Although, as I said earlier, it's not that much that we import from them, no. But indirectly, the price of rice has been affected by India. The world price of rice has been affected by India, and this has with other things also be together with the fuel increases. So there has been an increase in terms of our rice prices. So why am I discussing rice? Because it's actually our staple, and at the same time, many of us Filipinos are eating rice, and it's one of the highest share in terms of expenditures in food expenditures in our households. Okay, next one. All right. So the food inflation has increased as well, particularly within the last 2 months. So August and September 2023, and year-on-year inflation rates for vegetables as well and rice were relatively high in the last 4 months. So let me just point out here that maybe because later on you will ask what happened to the rice trade liberalization. Before the rice trade liberalization, the rice has really contributed a lot to the inflation, to high food inflation rate. But after the rice trade liberalization, rice was not the top contributor of food inflation. It was other commodities like vegetables, oils, and nuts, and also fish and fish products. Okay. Sorry about the small graphs and numbers there. So, but when it comes to month-on-month inflation for vegetables, it has declined from 11.2% in August to 2.5% in September. So, again, because of the factors that I mentioned earlier, rice has also become a contributor to high food inflation again. Okay, sorry. Next slide, please. Okay, so historically, if you can see, the food inflation contributes most to headline inflation, and high food prices translate to overall high inflation. I think I mentioned this already earlier, but I would like to emphasize that, as I said, among these food, the inflation in the price of meat and fish were the highest contributors to food inflation. And it's not rice, as I said, right? It's not, as I said earlier, before the 2019, it was rice who was contributed a lot, but now it's meat and fish. Okay. Next slide, please. Oh, no, this one is also important. So the food prices is actually this is where we see that there's a connection between food security and nutrition security. So food prices, when the high food prices would affect food security and at the same time your poverty. And then, so earlier the question that was raised to you in Mentimeter, some of you answered poverty. So that's already shown in the graph there. And then mostly affected actually are those poorest households who spend approximately 60% of total income on food. And so if there's an increase in price of food, particularly the staple food, then it eats a lot of their budget. So napupunta lang doon yung kinikita nila or their income to buying or purchasing food, especially on rice. So rising food prices could lead to malnutrition and other similar incidences. Of course, that's indirect way, but it was shown by Dr. Briones, one of the senior research fellows at PIDS, in his study in 2022, that the Filipino households consume meat or under-consume, sorry, the slide below, under-consume meat, vegetables, dairy and eggs, particularly those who are in the lowest or in the 20% bottom of our income class. So you can see that when the households are very poor, they under-consume this important food items with nutrients or protein, and so where these households could lead to malnutrition or undernutrition. So that's the effect, yung effect from higher food prices, then food insecurity, and then because of the high food prices, they can't really afford, and so it leads to malnutrition. Okay, next slide, please. Again, in Briones' study, he showed this graphs here on household consumption of rice, sugar, and vegetables, wherein the highest, these were the highest consumption for the poorest quintile, or the 20% bottom, the bottom 20%, and those that are richest or the highest quintile, they imply that the food groups are actually inferior. So as income increases, the less that they are going to consume rice. And so they would go for, if they are, as their income increases, the households would tend to consume more meat, more fish, more milk, and milk products, and fruits and vegetables. Okay. So next slide, please. I think I'm almost done. Oh, not yet. Sorry, I still have a few more slides. Okay. So in this figure, I'm just showing you the percentage of food insecure households, which was already mentioned by Dr. Urbeta in his introduction earlier on. And certainly there were a lot of food insecure among the poorest, as you can see in the graph here. And I won't go and then to that anymore because it was mentioned earlier in the introduction. So next slide, please. And so, as I said earlier, the link to that, next slide. The country's malnutrition statistics has been affected, and it continues to be elevated as well, and substantially. Again, the malnutrition is prevalent in the poorest of the poor. So there's wasting. You can see in the upper figure there, the wasting, underweight, and stunting trends. They remain relatively sticky from 2001 to 2019. So halos there was not much of a change, no. And if you look at the bottom figure there, the wasting, underweight, and stunting trends of children under 5 years old, which are also those who are mostly affected, are substantially greater for the poorest households. So mostly affected are those children under 5 years old and the poorest. So wasting, underweight, and stunting, if you can see the numbers, it's 4 percentage points, 20 percentage points, and 31 percentage points. As the households become poor, so there's a higher number of wasting, underweight, and stunting. Okay. Next slide. So again, you see in this slide the comparison between among the malnutrition in selected ASEAN countries, and it was already mentioned earlier in the introduction again that Philippines has the highest, is on top. So hindi lang tayo top importer, top din tayo in terms of malnutrition. In terms of prevalence of malnutrition or yung stunting and underweight. Okay, so next slide, please. So I have some preliminary conclusions here. We don't have yet the results of our regressions and analysis, partial equilibrium analysis, because we weren't able to get the data yet from FNRI, the latest National Nutrition Survey. What we wanted was to update what Dr. Briones has already done and show the changes from 2018 up to the present. So anyway, we have this preliminary conclusions. So at the international environment, the Philippines, if compared to India, it's a small open economy, and to other countries as well. So the vulnerability to international price and supply shocks is really affecting the Philippine rice market, and of course the food the food prices. So there's an indirect effect of world market price is increased because of the India export ban and also the Russian-Ukraine war. And we also note that these are short-term shocks. And we also note that the rice certification law can be reformed based on what is happening right now, and we can review improvements on the rice production, because that's the way to go. We increase rice productivity and not to control the prices, because we know that it won't really be effective if we implement price controls. And I think I have one more slide. Two more slides for the preliminary conclusions. There is no silver bullet solution to deflating rice prices because it requires multi-sectoral and systematic as well as institutional changes. As we saw earlier, in the conceptual framework, there were three clusters that has to be included in solving this increasing prices and food prices, and so if we shift our policies towards development rather than regulation, something might work. And so as I said earlier, we have to address really the production constraints for us to be able to increase productivity, and also that would also improve the competitiveness of our farmers. Okay, so next slide. I still have one more. So temporary reduction of tariff rates and increase MAVs on key agriculture commodities would be also one policy to consider. That also the easing of imports or the QRs like in fish and sugar. And we can also strengthen our ASEAN trade relations to ensure rice availability and affordability. We know that the RCEP has already been ratified, so let's take advantage of that. Take note that in 2008, when there was this food crisis, one of the countries that helped ease the increase in rice prices was Japan. So we should strengthen our trade relations with them, especially now that we have RCEP. And then we can also seek bilateral agreements on key agricultural inputs because of the high price of fertilizer and also of some commodities like sugar, wheat, and corn, and onions, the most controversial. And then, of course, one way also would be to provide unconditional cash assistance to subsistence farmers as identified in the registry or SBSA. And what we mean by unconditional transfers would be like technological development, mechanization, which some of the programs of the Department of Agriculture are already implementing. But to see whether it's really increasing productivity, that would also need an evaluation as well. And also, it would be also a good policy if we provide some transfer and say unconditional transfers to the bottom 20%, because we have seen that they are the ones that are really affected with the high food prices. So instead of price controls, why not provide unconditional transfers to the poorest of the poor? So it would not worsen the shortage, right? Next one. And provide, of course, nutritious food to the poorest of the poor. Okay, lastly, food inflation could be a major risk factor for child malnutrition. So thus, the policies and investments of the government resources should be aligned with transforming food systems to achieve the stability of food prices. Scaling up investment in climate-smart agriculture, research and development, nutrition surveillance, and early warning systems to monitor and treat severe and acute malnutrition. And lastly, for surveillance, the priority would be given to the pregnant women and infants because they are the ones who are really affected. And so if the government decides to provide food transfers, the focus would be to give them nutritious food, especially for the first 1,000 days of the infants and children. I think that's all I have. So thank you very much for listening.
And thank you very much, Dr. Tess Tionco, for that very informative presentation. Dr. Tess' presentation has answered a lot of very important questions. on how food prices impact food se- how food high food prices impact food security and nutrition. And I like the way how she crafted the recommendations. The policy recommendations are very comprehensive, and we will have more time to unpack those recommendations, as well as the what she presented during the open forum. And I saw in the chat, in the Q&A section, that there are already very interesting questions, and actually some of them have already been answered by Dr. Tionco in her presentation. So at this point, again, thank you very much, Dr. Tess, and we also thank the Congressional Policy and Budget Research Department, or CPBRD, for linking us with Dr. Tionco so she could have this presentation for this webinar. Okay, so at this point, we will jump to another very interesting topic, and this time we will look into maternal, newborn, child health, and nutritional health systems for indigenous cultural communities. And we are very pleased to have with us another expert, another academic from the DLSU, or De La Salle University, but this time from the Social Development Research Center. Let us all welcome Dr. Janet M. Arnaldo, who is a full professor and former chair of the Department of Sociology and Behavioral Science. She serves as president of the Philippine Sociological Society, and she has extensive experience as an evaluator of development projects in health, education, and agriculture. She held an Asia Fellowship at the Asia Research Institute of the National University of Singapore, and for her research on women and migration, she received the 2010 Outstanding Young Scientist Award in the field of sociology, given by the National Academy of Science and Technology. Dr. Arnaldo studies social inequalities and mobilities among the marginalized, and also she studies, conducts research on various topics in education, migration, work, urban agriculture, health, and spirituality. She obtained her doctorate in sociology from Virginia Tech. So Dr. Arnaldo can't be with us today, but she sent us a recorded presentation. So let's hear it. Team, please.
Good morning. I'm presenting an assessment report for the UNICEF project entitled Implementation of Maternal, Newborn, Child Health and Nutrition Health Systems Strengthening for Indigenous Cultural Communities in Selected UNICEF Areas. The objective of the project was to demonstrate a service delivery network model of quality maternal and neonatal health care among indigenous cultural communities in 3 barangays in selected municipalities in Region 12. The project design followed a participatory action research approach that transforms the marginalized to become agents of change. The main activity is called Apil sa Lihok, or Active Participation of Indigenous in Action. Apil sa Lihok involved core groups of IP representatives from the 3 barangays, the partner groups, and the technical support group. In Apil sa Lihok, selected IPs were formed into core group called IP Lead. They were given capacity building activities to prepare them for the tasks in this project, such as analyzing the causes of limited access to healthcare and availment of services among IPs, identifying and prioritizing possible actions to help address the problem of access to and utilization of health services, and engaging in activities that lead to accomplishing the desired action. 3 projects were identified to solve the problem of access to healthcare. And these are developing a water system, assisting in health registration, and procurement of emergency vehicle. The assumption is that if these three projects are accomplished or completed successfully, it will lead to improvements in the indicators of health outcomes, as these are supposed to address problems related to the service delivery. I would like to contribute to the discussion on community-based approaches. While hunger and malnutrition are not addressed specifically in this presentation, for example, there are no measures on stunting, wasting, or being underweight. There's nothing of this kind. The project is applicable to nutrition in the sense of enabling communities respond to their problems through community participatory approach. So this assessment was undertaken to provide UNICEF, the partner government agencies, and the public with an overall independent assessment of the performance of the project. It includes activities covered in two phases of the program. Phase 1 covers the scoping and designing of a mentioned service delivery network for indigenous cultural communities, and Phase 2 includes the development of mentioned SDN and process for sustainable implementation of a community-determined priority to strengthen health systems for indigenous peoples. So what is involved in this, or as an intervention, UNICEF provided the lead group. The lead is composed of IP members. So the lead group or the lead groups in the 3 barangays were given capacity building sessions. They were given skills on facilitation, proposal writing, coordination, organizing, and other skills needed to help them identify, analyze, and do something about the problems in their communities. Okay, so the evaluation framework in this study, it involves or includes relevance, effectiveness, efficiency, and sustainability of the project. I am only selecting aspects that I find most relevant in this presentation. So efficiency, the questions on efficiency might not be included. The figure presents the logic model on health systems strengthening of indigenous peoples' maternal, newborn, and child health and nutrition. It articulates the needed assumptions in the success of the project. The activities listed in the model are expected to result in outputs and outcomes, and they form the basis of this assessment. I will discuss only the outputs and the outcomes. So the outputs generated from the activities are as follows. Baseline data on IP health status in project areas, bottleneck analysis report on factors affecting access, quality, and utilization of services. Then there's the culturally sensitive communication interventions developed for implementation. And then number 4, 3 mentioned service delivery networks for indigenous peoples operationalized. 5 is a process documentation of the SDN model. 6 is monitoring and evaluation plan. 7 is annual quarterly monitoring reports. And 8 is the result of baseline and endline study. So for the outcomes, there are 6. Number 1 is increase in skilled birth attendants in deliveries. Second is a demonstration of a working model of mentioned SDN in indigenous peoples. Number 3 is increase in percentage of pregnant women with at least 4 antenatal visits. Number 4 is the availability of disaggregated health data for indigenous people. 5 is increase in birth and death registration among indigenous people. And 6 is increase in enrollment and availment of PhilHealth benefits among indigenous peoples. So very quickly on the methodology, this assessment employed mixed methods approach covering desk review, focus group discussions, and key informant interviews. 44 stakeholders participated in the assessment. So I'm not going to get into the details of the processing, analysis, and validation. As I've mentioned earlier, the presentation of findings will be limited to those that are relevant in this presentation. So this will be a little bit on relevance, a little bit on effectiveness and sustainability. One relevant finding under relevance is that the use of participatory approach was both successful and inadequate in the different phases and aspects of the project. Let us get into this. So the project's framework indicates a participatory approach, but the implementing partner only followed a participative process. The participatory approach was largely employed in the implementation and monitoring of the project, but not in the design stage. So it was not fully considered participatory. By participative, the IP lead groups were only considered beneficiaries of the project. So because they were seen as beneficiaries, that doesn't align very well with the idea of participatory approach. There were also no details on IP monitoring of the project. Regarding the participation of the indigenous communities and other stakeholders, it seems that the participatory approach was given more emphasis on the indigenous communities and less on the stakeholders. The one-sided application of this approach had repercussions in the outputs of the project. The participatory approach facilitated in creating a sense of ownership among the indigenous peoples, but this was not enough as the other stakeholders were not given sufficient participation in the project. Okay. There are limited indications of health system improvement. No, this is the finding on of the 21 observed areas with available data. 12 show improvement, while 4 indicate deterioration. This gives a net improvement score of 8 out of 21 areas. It means that an improvement of the health system is observed in 38% of the observed indicators in 3 barangays. So we are now looking at the indications of health system improvement in the 3 barangays between 2017 and 2019. So the indicators are the health outcomes mentioned earlier. No? The increase in the number of facility-based delivery in pregnant mothers, increase in the number of skilled birth attendants, increase in the total number of live birth registration, increase in the total number of death registration, and so on. So what you can see from this slide is that the expectation is an increase. So there should be an upward arrow in all of the areas. But what we can see here is that there is only a net improvement in Datuwasay and Tamban. No? In Datuwasay, there is a net improvement of 67%. And then in Tamban, there's a net improvement of 57%. And there is none or 0% in Datu Wasay. So overall, the overall score is 40%, no? Or a net improvement of 8. On effectiveness, this is a table on improvements in access to mentioned services among indigenous peoples in 3 barangays in 2017 and 2019. So you want to see a change in the access and utilization of services in these 2 periods. Okay, the finding shows that an improvement in access to and utilization of mentioned services for indigenous peoples in these 3 barangays was observed in a third or 33% of the data used. Net improvements in these mentioned services were 0, 50%, and 50% in Datu Inda, Datu Wasay, and Tamban respectively. This indicates a limited improvement. We distinguish between barriers to access and barriers to utilization of mentioned services. Access pertains to structural, administrative, or bureaucratic conditions or procedures, whereas utilization is agentic and decided by the health seeker. Barriers to access include geographical isolation, transportation limitation, and lack of money and PhilHealth benefits, whereas barriers to utilization are more about cultural differences. Social discrimination, prejudice, financial constraints, and PhilHealth and non-membership and geographical isolation and transportation woes are examples of these. Okay, finding 3 shows that when the project ended, 5 out of community implementation plans were fully completed, while the other 3 were partially completed. 2 of the uncompleted projects were considered as major projects, such as the setting up of a water system and procurement of an emergency vehicle. On sustainability, there are indications that some interventions will be continued beyond the lifetime of the supported project. The community's sense of ownership and capacity to maintain the outputs may facilitate sustainability. However, inadequate financial resources and indifference from barangay local officials pose a challenge. So likely to be sustained are the water system and the PhilHealth registration, whereas the emergency vehicle cannot be sustained as it was not achieved in the first place. Datu Inda completed the water system after the project's timeline and implementing partners' support. In this case, there is an indication of a community-driven support even on their own. The non-involvement of the barangay captain in Tamban was seen as a major deterrent to accomplish and sustain the project. His lack of sense of ownership resulted in the coordination difficulties with higher officials, and this resulted on the project on the emergency vehicle not being realized. Finding number 2, significant progress has been made in developing capacity within the community. This capacity has been manifested in the communities preparing plans for the sustainability of their project. For example, the IP leads are now knowledgeable on how to address their health concerns. They know the persons in government and non-government organizations to approach for assistance, as well as the strategies to approach these people. 2 examples of community initiatives focused on the importance of community and organizational capacity to deliver and sustain the intervention. One was the creation of the Datu Inda Water and Sanitation Association. Having this association would ensure that the water system infrastructure that the community intended to put up would be managed by the association beyond the lifetime of the project. Second was the reactivation of the Barangay Health Development Board to work on the health concerns of the IPs in Tamban. On the long-term plan, there's a long-term plan to sustain the availability of water in Inda. And this include protection of water source by planting trees and declaring water source as a protected area, assessing the quality and quantity of water supply, addressing future water problems by scouting for additional water sources, including rainwater collection systems. So these are good examples of sustaining the water in the area. Okay, for the conclusions of this project, the overall score is 2.77 out of 4. This indicates partial to large achievements. Rated highest is the area of relevance, which is 3.66 and approaching full achievement. This is followed by efficiency with a score of 3.0, which means large achievement. And sustainability, which is 2.66, meaning partial to large achievement. The lowest score for this project is effectiveness with a score of 1.55, which approaches very limited achievement. Okay, the last part of this presentation is the lesson, lesson on participatory approach, which I hope can be used in other contexts as well, such as on nutrition. So regarding key considerations for participatory project, in this case, there is limited participation. In this project, the participatory approach was restricted to implementation. So this is referred to as participative, rather than participatory, because the indigenous communities are not part of the project design. So the lesson here would be to enhance participation, to make it truly participatory and promote full ownership. We can consider including a representative from the indigenous communities in the project team, in the design team. Okay, so it's also important to balance attention to stakeholders. We need to decide which project stages require community participation and clarify the reasons for participation. Aside from that, we should also look into the levels of participation. We should determine the necessary degree of involvement, ranging from beneficiaries to co-implementers, to effectively contribute to project outcomes. So another lesson is on the role of experts in community projects. Reconsider the distribution of attention between indigenous communities and partner groups, especially barangay local government units, to maximize project benefits. Now, we should emphasize that community-driven projects require local government support for success and sustainability. So the problem here was that there was little activity or effort done to involve the local government, which is key to the success in the implementation of any project, as a lot of the resources lie in the government. Okay, finally, we should consider the role of experts in community projects. And the point here is to highlight the importance of expert guidance to ensure community decisions align with project goals. Example, in Datu Inda, the water project aimed to address health facility water supply, but it didn't connect with the health system's service delivery network. So addressing water issues doesn't necessarily increase facility-based service utilization. So it is important for the experts to facilitate or to participate as also to serve as guide to the community members, as they plan their projects. So that is all. Thank you very much.
And thank you very much, Dr. Anado, for sharing us insights from your project. In case you have questions for our presenter, just type them in the Q&A box, and we will send your questions to her. Because she cannot join us in the open forum, but she would be pleased to receive comments and questions from you. Okay, so at this point we will go to the next presentation. And earlier, Dr. Orbeta and also Dr. Tionco touched a bit about stunting, about malnutrition, and this will be the focus of our next presenter. Our next presenter is Dr. Valerie Gilbert Ulep, who is a Senior Research Fellow at PIDS. He is currently the Director of the Institute's research projects on health and nutrition. He is also a Senior Researcher at the Ateneo School of Government, and before joining PIDS, he worked at the World Bank in its DC and Delhi offices. He was a doctoral fellow at the University of Toronto Center for Global Health Research, where he conducted economic studies on tobacco taxes. He is a recipient of several awards, including Nikkei Asia and the Emerging Voices for Global Health. He holds a PhD in health economics from Canada and a master's degree in epidemiology. Earlier, we had a slide wherein we showed the co-authors of Dr. Ulep in this PIDS study. So at this point, I now give the floor to Dr. Ulep. Val, the floor is now yours.
Thank you, Dr. Sheila. I think I'm not allowed to share my screen.
Okay, team, let us give Dr. Ulep access to the share screen.
Okay.
Okay, there you go.
Okay. Okay, so good afternoon, everyone. So before I present our study, I just want to thank my colleagues at PIDS SERP for mounting this event. And we all know that nutrition is still a perennial issue in the Philippines' economic and health agenda. And I think conversations like this is critical to sustain the movement to push our policymakers to give importance to this very important topic on chronic malnutrition. So this paper was conducted, I think, in 2021 with our colleagues and partners from UNICEF and FNRI. So the idea of this one is to talk about or to determine or understand the causes of stunting inequities. So when I say stunting inequities, I will later argue that the level of malnutrition is important, but it's also critical to look at the differences of chronic malnutrition between the poor and the rich population. So if you want to look at the details of this paper or this empirical work, it's published in the discussion paper series of PIDS. So the title of this one is The Determinants of Socioeconomic Inequities and the Trajectory of Child Stunting in the Philippines. There are modeling exercises there that you could see. And the right side, so we also publish this in Public Health Nutrition. It's a peer-reviewed journal. So if you want to go through the details of the empirical work, then you may want to download this. So this is open access. Okay, so before we discuss the determinants of stunting inequities, I think it's important for us to discuss what do we mean when we say stunting, or in Tagalog, pagkabansot, no? So stunting is basically being short for one's age, no? So and the WHO has its operational definition of what stunting is, which is more than 2 standard deviation, no, below the standard. So I will not go through the details, but basically, masyadong maliit yung bata para sa kanyang edad, right? So it's being too short for one's age. So you can see the picture. This was, I think this was taken in Agusan, if I'm not mistaken, showing the height of children na 4 years old. Pare-pareha silang 4 years old, but they have different height. No, so that's what we mean when we say stunting. Okay, I will not go through this, but I think Dr. Orbeta mentioned this, no, the importance of stunting and why is it critical to be in not only in the health agenda, but in the economic agenda of many governments. No? So as you can see here, that when you are, so stunting is reinforced by poverty, health issues, etc. And when you are stunted, you are more likely to have cognitive impairment, and cognitive impairment is linked to poor school performance. And when you have poor school performance, that will affect your productivity and your health as an adult, right? And obviously that will have impact on your income and your future health, etc. So it's important for us to look at stunting because it could reverberate, you know, it could have huge impact in the medium to long term, you know? Not only in health but in the entire economy. Okay, so let's now see the problem of chronic malnutrition in the Philippines. I think there is a new number based from the National Nutrition Survey, but this study was conducted before the release of 2018, so we were using the 2015 National Nutrition Survey, but I think the results are still valid. You know? We're still seeing the same problem, even in the new National Nutrition Survey. So this one just shows you the magnitude of chronic malnutrition or stunting in the Philippines. No? That 1 in every 3 Filipino children are considered chronically malnourished. No? That's 1/3. No? Ang laki nun. So almost 30%. No? So when you look at other countries in the region, the Philippines is one of the epicenters of the burden of chronic malnutrition. No? The rate of chronic malnutrition is comparable to notorious countries with chronic malnutrition, like in South Asia, like Bangladesh, no? Or India. So we are that level. So I think Dr. Orbeta mentioned a while ago that the Philippines is one of the countries considered as epicenter for chronic malnutrition. So we look at the average stunting prevalence in many countries according to income. And you will see here that the Philippines will be transitioning to upper middle income country. That's 2025, no, if I'm not mistaken. That's the projection. But if you look at countries in the upper middle income tier, their stunting prevalence is only 13%. No, tayo is 30%. So we are considered as upper middle income countries with an outcome similar to the poorest countries in the world, like in South Asia or countries in sub-Saharan Africa. No, so may ganung disconnect. No, and it's a discussion whether we consider ourselves, no, as upper middle income country, you know, when it comes to nutrition and health outcomes. No. I also want to show you the level of decline in chronic malnutrition or stunting in the Philippines relative to its neighboring countries. You can see the red line that in the last 30 years, you will see like very slight decline in the chronic malnutrition prevalence compared to many other countries in the region. No? And I think one of the striking data that we've produced in the last few years is comparing high-performing countries when it comes to stunting reduction. No? and that is China and Vietnam, for example. Their annual reduction in chronic malnutrition is around 5 to 6%. No? And for example, China in 1990s, the prevalence of chronic malnutrition in China and the Philippines are almost the same. No? But in the last 30 years, they were able to reduce that to less than 10%. No? And that jives with their economic growth, no? in China. And for the Philippines, you will see stagnant lang siya. Like it's not moving in the last 20 years, in the last 3 decades, if I may correct. No? And the left and the right side also shows you Vietnam. And there are a lot of significant economic activities in Vietnam in the last 30 years. No? Like the Doi Moi, etc. But those were translated into improvement in nutrition and health outcomes. In the 1990s, the stunting prevalence in Vietnam was almost 60%, no, and they were able to reduce that to around 22% in the last 30 years. Again, comparing it to the Philippines, we are just like stagnating, no. But if you look at the National Nutrition Survey, there was a decline in chronic malnutrition, but I think that's still modest compared to a lot of countries that observe large reduction in chronic malnutrition. Even in many countries like India, for example, or many sub-Saharan Africa, they've noticed large declines in chronic malnutrition. But in the Philippines, we don't see that large reduction in the last 30 years. Okay, another important is, I call it the paradox, because when we look at growth, economic growth, the theory in economics is that when there is economic growth, that will trickle down to improvement in well-being, right? And that is a theory that many of us consider. No? But what we've seen at the regional level in the Philippines is that we don't see that relationship, that although in many regions in the country, GDP per capita, which is a measure of income, has dramatically increased, no, in the last 2 decades, but we don't see that translating into improvement in health and nutrition indicators. In this case, stunting rates. No, so you don't see that relationship. Okay. And I think the heart of this paper is looking at disparities. No? So I've said, as I've mentioned, the chronic malnutrition rate in the Philippines is very high, like 30%. But what we are arguing is that the difference makes a lot, the difference between the richest and the poor is also critical to examine. Right. So as you can see here, we'll look at the difference in the absolute disparity of the richest and the poorest Filipinos. No? So if you look at that absolute difference, yung difference ng mayaman at mahirap in terms of prevalence of chronic malnutrition, the Philippines is considered one of the highest. No? Next lang yung Rwanda, I think in Guatemala. No? But the rest is that the difference between the poorest and the richest is very, very minimal. No? In the Philippines, you will see large inequities, no, in terms of stunting rate, no. And I will explain later why it matters, no. Now, the difference is important to think about, not only the absolute difference. So here, again, it's just showing us the level of the extraordinarily large inequities in the Philippines in terms of chronic malnutrition rates, no. So even if we look at the National Capital Region, for instance, like, if you look at the poorest and the richest National Capital Region, the poorest children in NCR has a stunting rate similar to many poor countries in Africa, for example, right? So you will see the red dot there. No, in ARM, you will see large differences also. There is variation within the regions, and there are variation, intra-variation, and inter-variation, regional inter and intra-variation of chronic malnutrition in the Philippines. No? Another important thing that we've trying to look at is comparing, for example, countries. So the chronic malnutrition rates of poorest countries and relative to the Philippines. So we analyzed, for example, Bangladesh. Bangladesh is one of the poorest countries in South Asia, and we look at their Z-scores, or the prevalence. For this one, it's the stunting rates of the poorest Bangladeshi, and the poorest Filipinos, and you will see that they're almost the same, But when you look at their income, it's quite different, Mas malaki yung income ng Pilipino kaysa sa Bangladeshi, but when you look at their stunting rates, it's almost the same, We look at other NDHS and we see this kinds of if we see this kind of pattern, but obviously when we compare it to other countries like in Indonesia or Thailand, may mga variation. But the point here is that even though the poorest Bangladeshi will have relatively lower income, parehas tayo ng stunting rates on average, and that is very telling for us. Why is it like that? Another important thing that we need to discuss is this trajectory of chronic malnutrition over time. What you can see here is that the disparity between the poorest and the richest Filipinos or Filipino children begin to diverge, after 6 months. So you will see that after 6 months, that disparity widens a lot, and that disparity is sustained until the second birthday, which is 24 months. And after 24 months, then that's it. It will stagnate forever, right? And what do we mean? And what is the policy implication of this is that we need to really address this critical period or this acceleration phase in chronic stunting, a chronic malnutrition, which is at this period, 6 months until 12 months. So if we begin to intervene after the second birthday, I think wala na tayong magagawa, to be honest, like at least for chronic malnutrition, because that will be sustained forever. There is no empirical, there are like, there are some empirical evidence that it could be averted, etc. But in general, it's really hard to avert that disparity after the second birthday, right? You can see here that sustained chronic malnutrition, over time, until 5 years old na sila, until adult na sila, you will see that difference in stature, And I think this is just what I was saying. After second birthday, it will stagnate, that gap, Okay, so the point here is that the main objective of this paper is to look at what really determines that difference. So we wanted to empirically measure what's really causing that difference in stunting between the poorest and the richest. Here, I just want to show you why it matters, that the prevalence of chronic malnutrition is related to the disparity. So there is a positive relationship. The point here is that when we try to reduce that gap in disparity, it will have huge implications on the average. So when we tackle chronic malnutrition, we need to, I think the idea is for us to reduce that inequality, in the disparity in chronic malnutrition between the poorest and the richest. That's what we are trying to do here. Understand the determinants of that difference so we can reduce that gap. Okay, so here we use the National Nutrition Survey, the 2015. We've used different modules of the National Nutrition Survey. We look at the population, children aged 6 to 23. We did an OACA blinder decomposition to understand what determines that difference. And we look at the differences in the bottom 40% and the top 60%. I will not go through what OACA blinder decomposition, but basically it's used in wage decomposition. but basically trying to understand what determines that difference. So here we are just using this framework to understand or to identify which factor could affect the difference. So I have food security, feeding practices, environment, healthcare, right? Because this will have implications on dietary intake of the child, and this will have implications on child's propensity of being ill. No? So in our understanding, and if you look at clinical literature, there are two direct pathways of stunting. Number one is dietary intake, right? So if we are not feeding the child properly, both quantity and quality, that will have huge implication on stunting, right? Another one is another pathways through child disease. Now, imagine when a child is constantly exposed to diarrhea, for example, or any illnesses that is a physical assault to the body, no? And that will lead to stunting. No? So there are two pathways, direct pathways, in which stunting could really affect, no? In which child could be affected, no? By stunting. That is through dietary intake and through child disease, no? Exposure or propensity to be exposed to illnesses. No? So what we've done is to look at these differences, and what we've seen is that these are the factors that appears to have contribution to that difference. So what I'm trying to say here is that if you add all this share of gap, it should be like 100%. No, so my point is, if you go back to this, if you want to look at the difference of the difference between Q1 and Q5, that area could be explained by this factor. So what we've seen here is that maternal height is a very important factor, and I'll explain why maternal height is critical. We've seen maternal education as an important determinant or contributor of that differential. Maternal BMI, which is also an indicator of maternal health. Another one is dietary diversity score. This is related to the quality of intake or the food intake of the child, the quality of prenatal care, and iron supplementation. So I think that the main point here is that chronic malnutrition is not only driven by food. Your access to healthcare services matters. Your health, the health of the mother matters a lot. Even maternal education. So I think there is no silver bullet for addressing chronic malnutrition. And when we say that, okay, let's address chronic malnutrition by feeding, and I think we are missing the point, right? Of course, feeding is important, but there are other factors that come into play in understanding that differentials, of the poorest and the richest, and I explain to you later. So this one is just shows you the results of the OACA decomposition, that 82% are explained, and the other 7% is not explained. But I will not go through that. The 82% is basically the factors that I've mentioned that could be explained, but there are factors that are not taken into account, which is around 7%, but we'll not go through that. Okay, so I want to go into the details of each and of the critical factors now. Number one is maternal education. It's a very important factor. It's important determinant of that differential. And if you look at literature, maternal education is critical because it has many different pathways on how it affects nutrition and health of the child. One of that is, if you look at economic literature, formal education will increase knowledge and understanding of child feeding and rearing, changes in dietary choices, etc. Improvement in social capital network that leads to increased knowledge and healthcare access. So maternal education is critical. So and the point here is that when we look at chronic malnutrition, we need to go beyond the child, right? So and this is what we are trying to say, that the first 1,000 days is just not about feeding, right? It's about the child's exposure to the environment, including his or her parents, characteristic, And you will see here, we try to look at these. We try to examine the the disparity in knowledge on exclusive breastfeeding, complementary feeding. By education, you will see large differences. I think I'll try to make it fast. So another important factor is the quality of prenatal care. We always talk about, they need to have a for prenatal care, but the question is, are we giving them the right prenatal care? Are we giving them iron? Are we giving them advice, etc.? The quality of prenatal care matters a lot, not just the access to quality of, just access to prenatal care. Another one is maternal height. Maternal height is an important tracer for maternal health, and maternal underweight. So if and maternal underweight or maternal malnutrition is very important here. We did some several analysis looking at maternal height. And what the point of this graph shows you that the prevalence of maternal malnutrition is very, very high during early 20s. The prevalence of maternal malnutrition is very high, and that is the period in which they have the highest probability of getting pregnant, right? And the point here is that we need to delay the pregnancy, because if they become pregnant at the period when there is high level of maternal malnutrition, then you will expect that to have an implication on the child. But I could explain this later. Another one is dietary diversity. It's a very important driver of that difference, and you will see that only 30% of children have diverse have a minimum dietary diversity. When you say minimum dietary diversity, is like enough carbohydrates, enough protein, etc. In the Philippines, only 30% of children have that diversity. It varies by socioeconomic class. And you will see the composition of food of family household, and most family and the poorest will likely to eat carbohydrates and less of like proteins and oils. So again, I think this is related to Dr. Briona's paper. But the point here is that the quality of food matters a lot, not just the amount of food, but the diversity of the food intake. I think these are just a few recommendations that we've included in the paper, but basically trying to protect the lowest socioeconomic the household from the lowest socioeconomic status, like expanding secondary education, reducing dropouts among the poor, improving maternal education among the poor, access to healthcare services among the poor, and improving primary healthcare system, which could improve comprehensive access to maternal nutrition services for both the mother and the child. So I will not go through them, but it's basically targeting the poor in terms of a comprehensive interventions for health and nutrition. So thank you so much, and sorry for overtime po ata ako. So over to you, Ma'am Sheila.
No worries, Val. We're very pleased with that thought-provoking presentation. Thank you for explaining to us the determinants of stunting, and emphasizing that chronic malnutrition is not just driven by food. Our topic today is about food security, but it's important to emphasize, as you have mentioned, that chronic malnutrition, when we talk about it, it's not just driven by food, but it's also driven by other factors such as health and nutrition services, and we can talk more about it during the open forum. So if you have questions for Dr. Val Ulep, then please free to use our Q&A button, and we will respond to your questions later on during the open forum. So at this point, we'll go now to our last presentation. So we have been talking about food security, about nutrition issues, and in this presentation, our presenter will enlighten us about the technology that could possibly elevate food insecurity at the household level and even at the community level. And our presenter today is from the Mariano Marcos State University, where he is a professor. Professor Giovanni Stanley Malab is from the Department of Agricultural Sciences, College of Agriculture, Food, and Sustainable Development of MMSU. Professor Malab specializes in crop management and plant tissue culture. His research interests include biotechnology, crop management practices for seed production systems, and morphological characterization of indigenous vegetables. Here to present to us their study on biointensive gardening, let us all welcome Professor Malab. Sir, the floor is now yours.
Okay, good afternoon, everyone. Okay, I am also tasked to present to you our humble accomplishment in our extension projects in Ilocos Norte to address food security during the advent of pandemic. So the title is Biointensive Gardening for School and Household in the City of Batac, Ilocos Norte. This project is implemented by several units of the university, and let me acknowledge my companions. So we have Ms. Marisa Atis from the Research Directorate, yours truly from the College of Agriculture, Food, and Sustainable Development. We have also Dr. Aris Cahigal, Ms. Belia Gervasio, Ms. Mercy Gagno, then we have Dr. Sherlina Nicolas, all from the Extension Directorate, and Ms. Abigail Marcelino as our project staff. Okay, so this project is also funded by the Department of Science and Technology through the Philippine Council for Agriculture, Aquatic, and Natural Resources Research and Development, or PICARD. Next. Next, please. Okay, so one of the ripple effects of the pandemic that needs to be addressed is the threat of hunger, as mentioned by the former Secretary of the Department of Agriculture, Dr. William Dar. Next. The repercussions of the COVID-19 pandemic have deeply impacted the well-being and sustenance of Filipino households, causing a paradigm shift across societal domains. Throughout the extensive lockdown and imposition of measures during the peak of the pandemic, much of our daily routine ceased and agricultural operations experienced momentary disruptions, imposing impact on food supply chain. Next. However, the government initiatives that are intricately linked to the execution of the Presidential Decree 491, or commonly known as the Nutrition Act of the Philippines, were launched to ensure the provision of sustenance to the Filipino, of which one is the Plant program of the Department of Agriculture, which emphasizes the growing of your own food. Next. Well, in the case of the Ilocanos, we all know for the fact that they, or we rather, are vegetable eaters. It is always a requirement to have a vegetable dish in almost every meal, from breakfast to lunch and dinner. So we love vegetable more than any province in the Philippines. That in our fondness to vegetable, Ilocanos are sometimes tagged as pinakbet or the saluyot people. And during the pandemic, much of the households engaged themselves into vegetable gardening, while some get into head over heels to ornamental plants, that the word plantito and plantita came into existence. But for those engaged in vegetable gardening, maximize producing vegetable in small areas in their community and backyards. The city government of Batac therefore revived the Gulayan sa Barangay project in every barangay in the city. Next. With this, the Mariano Marcos State University, as a partner of the city government of Batac and as part of the community, the BIG, or the biointensive gardening, was envisioned as an excellent modality for us to be integrated to the community and they be able to feel our presence as the leading state university in the northern part of the country. Well, biointensive gardening, or the BIG, is a typical home garden premised on a high diversity of economically important plants per unit area. resulting in a unique combination of high levels of productivity, sustainability, as well as equitability. And this could therefore be a highly valuable source of cheap and nutritious food, which is equitably shared among members of the household, as well as it could be extended to the neighborhood, thereby enabling them to save on food expenses. And in addition, the food that is being produced in BIG is safe and chemical-free as it advocates the adoption of sustainable agriculture in backyard vegetable growing. Next. And one of the issues in the SWOT analysis of Philippine agriculture under the socioeconomic weaknesses is the decreasing interest in agriculture of the young generation. And this is identified in surveys that less and less are taking agriculture as a course. So we should involve the young generation in vegetable gardening, and schools should integrate livelihood education in the curriculum to develop the sense of environmental consciousness and the love for vegetable. Should start early. Next. So the general objective of our project is to increase food security of depressed areas and schools in the Ilocos region through the adoption of the BIG. Specifically, promote the adoption of BIG and enhance capabilities of household and elementary pupils and teachers in biointensive gardening. Also, to develop and disseminate IEC materials on biointensive gardening and establish model farms in depressed areas and schools in the region. The BIG is, the BIG project, which incorporates organic agriculture, complements the Gulayan sa Paaralan program implemented in public schools nationwide, particularly food production in the schools and in the home. So the project has several mechanisms of implementation, one of which is the conduct of seminars and skills development, as well as training on BIG in urban public schools, as well as households, distribution also of vegetable farm inputs, as well as production and distribution of the IEC materials on the BIG or the BIG. Next. Okay, to start the project, several meetings were conducted to level off and have a common understanding on the project implementation, both at the level of the funding agency and the project implementors. Next. And eventually, this was cascaded to the Schools Division Office or the SDO of the City of Batak, wherein the SDO identified and coordinated to the possible beneficiaries or qualified beneficiaries and partner schools. Next. A consultation meeting was conducted involving several or representatives from various elementary schools identified by SDOs, by the SDO and the school principals and the designated focal person for the vegetable production project. Next. To codify and formalize the partnership, a memorandum was prepared and signed by MMSU and the Schools Division of the City of Batak. Next. After those preliminaries, the ground preparation started with the establishment of seedlings at the nursery. And seeds were sourced out from the organic production projects of the university, as well as some other partner agencies within the locality. Next. Beneficiaries were required to attend a series of technical briefs as pre-dispersal training. And during the restrictions of the pandemic, this was conducted virtually. This briefing oriented the beneficiaries on the project, its implementation scheme, and their roles and responsibilities as recipients. It also included topics on farm record keeping, becoming active change agents in their communities, and values orientation. Okay. And the production technology briefing was also conducted to orient the beneficiaries on the production technologies on the various crops covered and adopted by the project. And the failure to attend the briefing is a ground of disqualification, and the proxies or substitute were not allowed to the beneficiaries. Next. Okay, prior to the implementation, background checking and an ocular inspection was also conducted to assess and evaluate the areas where the project will be established. This is to establish the physical presence and suitability of the area, collect soil samples for soil analysis, and to gather baseline data on the farming practices or systems. Next. IEC materials on the different processes or technologies on biointensive gardening, particularly on vegetable, were printed, multiplied, and distributed to the teachers and other interested individuals during the conduct of the seminars and trainings. Next. The prepared vegetable seeds or seedlings and farm inputs such as organic fertilizers were also distributed to the beneficiaries. Next. And regular monitoring and providing technical assistance were done by the project staff to keep records and identify problems encountered by the cooperators and beneficiaries. Next. The monitoring of the project was done not only on site, but also online means because of some restrictions posted by the pandemic. Next. And the following data or baseline data information were gathered from the beneficiaries, such as area planted and the crops planted or previously planted, and later on the yield was also recorded, farm practices or systems, problems met and their coping mechanisms, use of products or how were they able to sell their produce, and other important data. Then we have the gross income is also noted, and personal experience, opinion on how biointensive gardening impacted in their lives were recorded, and soil analysis were also taken. Next. Well, here are the highlights of the project. Next. Partnership and collaboration between the pre-dispersal training was conducted to apprise the beneficiaries and cooperators to the project. Next. And the memorandum of agreement was formally signed between the agencies involved in the project. To be specific, we have MMSU and the Schools Division Office of the City of Batak. Next. Well, there were 40 elementary pupils involved, 10 each from the 4 elementary schools of the City of Batak, Ilocos Norte. It was noted that more males were involved than the females in this activity. Next. Of which they planted or they use or utilize more or less 100 square meter land area, and some used container for containerized gardening or urban gardening, and where they planted seeds of vegetables such as okra, sitaw, pechay, as well as tomato, finger pepper, eggplant, squash, and bitter gourd, practicing the sustainable production system. Next. And Here are some of the benefits adopting the organic production, organic vegetable gardening, as being claimed or pointed out by the beneficiaries. One of which is they become more active in gardening, especially in planting vegetable, and had a healthy and fun experience in doing that activity. And it's a fruitful learning opportunity for them or for the young people. And it's a ready source of vegetable for domestic consumption and for some of them used for livelihood. Next. And as part of the learning in the school garden activities, the project spearheaded a competition on cooking different vegetable dishes. This was done at the peak of the fruiting stage of the vegetable of the pupil beneficiaries, wherein they formulated new and unique dishes using their own ideas and creativity. This activity made the beneficiaries active and excited. Further, it also fostered camaraderie to other schoolmates and motivated other pupils to establish also their own vegetable garden and explore the varied ways of cooking vegetables. The cooking competition brought the best creative ideas of the pupil in preparing vegetable dishes. It was an opportune time for them to explore varied ways based on what they learned in home economics or what they usually observe at home. In addition, the cooking competition reignited the pupils' awareness of vegetable as important part of their healthy diet. Next. And here are the pictures of during the cook fest. And we have Catalino Acosta Memorial Elementary School next. Baay Elementary School next. HBMS next. Mariano Marcos Memorial Elementary School next. As per their farm record, most of the pupil beneficiaries had their harvest for home consumption, and some of them sold their crops for their neighbors and their teachers. Next. And the following slides would now would be the testimonies of some of the beneficiaries of the project. I will not go into deeper on this. Next slide, please. Because they are in Ilocano next. However, we can point out some of their testimonies, and these are just some of the positive feedbacks provided by our beneficiaries as they enjoy the benefits they gain from the BIG project. Okay, next. And here are our best practices. We go. I will now go into this. Can we proceed next? Next. And we have, there are some promotional activities that was done. And this is in order to promote the technologies adopted and make the project visible to the public. We have the press releases next. The use of webinars and mass media modalities was also used. Next. And the effect of the increased public visibility of the project and outputs of the student on various media, there is now growing interest on vegetable production among the locals, particularly among the pupils of the schools involved. Next. And here are our outputs. Next. Next. And for our way forward, there should be, we should establish promotion of inter-school communication, that we should advocate for ongoing communication channels between project coordination and school officials to facilitate the seamless replication of successful initiatives, and the expansion of vegetable gardening in TBL agricultural schools, that we should encourage the integration of vegetable gardening initiatives in DepEd schools, particularly those offering TBL, agriculture programs, and agri-fishery arts strand. The need to emphasize the potential benefits for students, emphasizing the hands-on application to enhance technical knowledge and skills in vegetable farming. And next, the integration of vegetable gardening in elementary schools. You should extend the implementation of vegetable gardening initiatives to other elementary schools, aligning it with the Gulayan sa Paaralan program. Support teacher in guiding pupil to apply recommended technologies for sustainable vegetable farming, fostering a culture of environmental awareness and practical agricultural skill at an early age. Then next, there should be the teacher training and support. Implement training programs for early childhood educators to equip them with the knowledge and skill necessary to teach basic gardening concept to the young children, and establish support system including mentorship program and resource sharing platforms to sustain teacher enthusiasm and effectiveness in integrating gardening into their teaching. And lastly, community involvement, foster community partnership to involve parent and local volunteers in gardening activities within early childhood education setting, and organize community events such as gardening workshop or harvest festival to create a positive and inclusive atmosphere among agriculture. I think that's all. Thank you very much.
At maraming salamat po, Professor Giovanni Malab from the Mariano Marcos State University. Thank you for sharing with us insights from your project, and congratulations on its successful implementation in Batac, Ilocos Norte. This is something that other schools and LGUs can emulate, no?
Yes.
By other LGUs, but also taking into consideration specific limitations in an LGU such as the availability of land. And I remember we had also a webinar on gardening, but urban agriculture, urban gardening. So this it complements well with this discussion. Okay, so maraming salamat po to all our presenters. And at this point, we will now go to the open forum. So if the other presenters could join us, you also open your cameras so our participants can see you. However, most of the questions have already been answered by our presenters. Actually, most of them were directed to Dr. Tionco. So Dr. Tionco, thank you very much for already answering those questions in our Q&A box. But there are still some relevant questions that are left unanswered. And one is from, okay, let me pick this question from Mr. Nicolas Graged of NEDA. He said, considering the increasing food prices, particularly on our staple food, has there been any signals observed signifying changes in consumer food preferences or shifting to alternative food products? Will the increasing food prices potentially change the way Filipinos eat? So any insights that that you can share? Have you seen any shift in the food preferences of our of Filipinos with increasing food prices, such as, for example, instead of rice, they shift to, let's say, less costly alternatives such as perhaps sweet potato and other and food crops? Okay, okay. I'm not sure because my screen froze. Did you hear the question? Hello?
Yes, Miss Sheila.
Yes, yes.
We can hear you.
Okay. Anyone who would like to jump into the discussion? So did you see any change in terms of food preferences now that we have high, let's say in terms of high food prices like rice, may nakita ba tayong trend na gano'n na nag-shift to other food alternatives? Can we start with Dr. Tionco? And now we can also
thank you for that question. I was about to type my answer to that. So anyway, for everyone to hear my answer to that. Yes, there, especially for those who are in the middle class and upper class or upper income classes, there's really a shift. We don't have the evidence yet because the FIES is not yet out for the latest FIES. If we look at the current, if we factor out the current increases in prices, but previous increase in food prices have already affected the diet diversification. Not for those who are at the bottom, 20%,
Okay.
more so of the middle and the upper class. Yeah.
And diet diversification, this is one of the determinants mentioned by Dr. Val Ulep in
Yes.
in his presentation. So Dr. Val, how do you think will this affect the health and nutrition of the Filipino population, considering that diet diversity is an important determinant?
Yeah, for your first question, Ma'am Sheila, I think we need more evidence whether, I mean to say whether there are changes in the dietary patterns of Filipinos because of income. We need to do more investigation on that. But regarding the dietary diversity, there is really large variation across households. As I've said, the poorest household will tend to eat more carbohydrates compared to protein. And we all know that protein is an important driver of stunting. No? But we need to see that if there are also changes. No? Bas dumami ba yung kinakain nilang rice or carbohydrates because of the increasing income? Do more investigation. But it's a very important question that we need to answer.
Thank you, Dr. Val.
But we know na nag-increase kasi yung food insecurity during pandemic. So we also need to look whether that changes happened during the pandemic.
That's right.
A lot of investigation that needs.
Thank you, Dr. Val, and thank you, Dr. Tess. And Professor Malab, sa lugar ba nyo, let's say sa Ilocos Norte, did you see any change in the dietary patterns, no, shifting to less costly alternatives? Ganon. Mahilig sa gulay ang mga mahilig sa gulay ang mga Ilocano. Pero sige po, sir.
Ang naging kasi ang naging complication pa kasi yung problema namin sa ASF. So talagang na-increase yung consumption ng vegetable dito sa amin.
Okay.
Kasi we have ang mahal-mahal na ng meat products and the meat itself, and we have limited supply na. That's why we opted na lang doon sa mga alternative sources of protein, na vegetable and other products.
And which is good, because we need vegetables, but of course dapat balance yung diet. Hindi naman pwede na na veggies lang, no? Dapat may protein din. Okay, let's go to another question, and we have one here from Manuelito Toilo of Gawad Kalina. Would you recommend feeding programs as one of the solutions to address stunting and malnutrition of children? Well, this feeding programs, ginagawa na talaga ito. But this is also related to the question of Maria Lourdes Mendoza of the House of Representatives. If you were to design a comprehensive program to address malnutrition, what are the other sub-programs to feeding programs? Because I've heard of, yung parang incorporate mo yung WASH with nutrition, di ba? Water sanitation and health services. So any thoughts, further insights on this? I saw Dr. Val Ulep nodding his head. So I'll go to Dr. Ulep first, and we can go to Ma'am Tess.
Okay. Thank you, Ma'am Sheila. I think the short answer of that is it depends. No?
Okay.
And the period, the age is critical. So if we are feeding if we are doing school feeding lang, like 6 years old na yung bata, and we use it as a tool to address chronic malnutrition, I think there will be a significant difference. Right? But if we are feeding during a critical period in child's life, which is 6 to 12,
6 to 12.
that might have huge kasi when you look at the data, yung minimum acceptable diet during the 6 months to 12 months is sobrang baba. So hindi tama yung kinakain ng mga bata 6 months to 24 months. So if we do feeding, then it might make a difference, right? So if we feed also the mother, pregnancy, that makes a big difference. So yung time period is importante. But if we are banking on feeding to address chronic malnutrition, there is huge impact. So yun yung dapat tignan natin. Yung timing is very important.
Timing,
Second question po, ma'am, no, ma'am, if you ask me how do we address chronic malnutrition, and we stated this in the paper that there is no one solution, and the short answer of that is we need to follow the 3C: continuous, comprehensive intervention. No, ang problema sa Philippines is that we are only looking at one intervention, but when you look at it, chronic malnutrition is an accumulation of the failure to provide all the services during the first 1,000 days. Right? So if your system is not providing all those services within that 2 period, then it will manifest. So my point is there needs to be a system that the child receives all the intervention during that period. So how do we do that operationally? So one successful story, for example, is in Costa Rica and a lot of Latin American countries, is that they invested in community healthcare workers that will actually follow the pregnant women until the second birthday. So pumupunta yung healthcare workers to look into whether na-immunize na ba siya, kumain na ba siya, etc. In that first 2 period, no? Those are the major drivers of why Peru and Costa Rica have large reduction in chronic malnutrition. But yeah, it's a systematic, comprehensive way of delivering health and nutrition services at a critical time period.
Yeah.
There's no way to address malnutrition but to do that. No? So I think if you ask me to design, is like how do we watch in that years? No.
Thank you,
So,
Dr. Val, for emphasizing that intervention should be, given at the right time. It should also be comprehensive and should also be continuous, no? So hindi yung one shot lang na okay, magpapakain tayo ng mga bata.
Nabakunahan na, tama na, nabigyan na ng pagkain, tama na. Like, it doesn't problem. Like, and yun yung problema in many of our programs, like one shot only, but we don't organize that they receive it continuously. Like, walang ganun.
That's right. That's right. Dr. Tess, would you have anything to add? No, since your paper, your presentation touched on yung intersection between food security and stunting and malnutrition.
Actually, Dr. Balas already mentioned what I was about to say, and I just would like to emphasize yung timing. Talaga, it has to be. Kaya gusto ko yung first 1,000 days. So, yun yung critical days ng bata. And through also with the school feeding. Kasi hindi din nutritious sometimes yung, hindi minsan nutritious yung mga binibigay. Basta makapag-feeding program lang, ganun. It should not be the case kasi sayang yung resources mo for that. I mean, there's budget, but then we have to spend it wisely.
That's right. Thank you, Dr. Tess, and thank you, Dr. Val. So, okay, we have other questions here. I think we can entertain 2 more questions. Okay. Ma'am Tess, this is for you. From Carl Galvez of Visayas State University, how would decreasing tariff rates on imported agri-production inputs harm government revenues? Why are there no calls for the reduction of these tariff rates? This is one of the questions in our Q&A box.
Yeah, I think I answered that already.
Okay.
I couldn't find my answer to that. Dami kasi.
Actually, ang dami mong questions,
Yeah.
Ma'am Tess.
But yes, it could. Ang short answer ko doon, yes, it could harm the revenue of the government because you're lowering the tariff, so that would affect the income of the government. But then tariff is a way of protectionist tool that could also protect our local farmers. So if we want our local farmers to be protected, we don't have to yung sobrang low yung ating tariffs kasi then alam naman natin consumers will now be buying cheaper products, which is kung lower yung tariffs mo, mas mababa yung yung price ng imported goods. So kawawa naman yung ating mga farmers.
Thank you very much. And another question from Nicolas Grageda of NEDA. Okay, we've already answered that. From Prince Cal Manghot of the Office of Chairman Enverga of the House of Representatives Committee on Agriculture, the country's food production has always been a bit short of the ideal level of its locally produced products. Are usually more expensive than imports, thus the necessity to import. Can you please expound more on how to balance the concerns on food availability and food affordability with the country's food nutrition and security needs? Okay. Balancing the concerns on food availability and food affordability with the country's food and nutrition security needs.
So yeah, that means if we can afford and we can access the food that is available to us, it's supply and demand, right? So it's a basic question actually whether we can have enough supply. And I think the presentation kanina of Professor Stanley Giovanni would really improve the food supply by doing urban gardening and producing at the community level, more localized in productions so that you have more supply, so there's going to be food available for everyone in the community. And then in terms of food availability or affordability, that's the purchasing power. So that's where our food inflation comes in, no? So dapat bababa yung ating food inflation para our purchasing power we can afford to buy.
That's right. Thank you, Dr. Tess. And this will be our last question from Dr. Ray Navarro and to Dr. Val again. The Philippine Plan of Action for Nutrition had ended, yet stunting is still a problem. What is now the move of the present government to this problem? Well, this is quite a difficult question, but yeah, short answer, Dr. Val. We have the universal healthcare.
PIPAN is just a plan, right? So at the end of the day, it's how you implement the plan. So I think that's a different question, whether we need to assess whether we've reached the targets in PIPAN, etc. But like, for example, one of the main indicators, the minimum acceptable diet, hindi siya nag-move, right? So mga ganun. So it's just a plan, but implementation-wise, it's a different story, and we need to kind of assess whether we've accomplished all those targets. So.
Thank you, Dr. Val. And perhaps I can have this final question for Professor Giovanni Malab, no? Because in your project, most of the participants, I think all of the participants were children or were school children. So I was wondering if you covered in your study, how has the project, considering that, this with the participation of these children, how has this project influenced their parents? For example, parents who, let's say, do more BIG, do more intensive gardening?
Yes, ma'am. But there's a great involvement of the parents, ma'am. Kasi part of the inception is we need to discuss the implementation with the parents. That's the criteria for us. If the parent would allow the children to be involved,
I see.
that's one
Okay.
of the
Thank you for the
criteria.
clarification. Okay. Thank you. I missed that. Okay. Thank you very much. And well, best of luck on your project, Professor Malab. And to just
Thank
cap
you.
our discussion, may I ask our presenters for some brief final words if you have any. So let's start from Dr. Tiongkot, then Dr. Ulip, and then back to Professor Malab. Ma'am Tess?
Well, thank you so much, Dr. Sheila. Key takeaways. Let's not really worry much about the food inflation because those are temporary shocks. So if we react too much, then that's where this equilibrium comes in. So as I'm always in favor of that, let the markets work for us. And let's recall the story of the toilet paper during the pandemic times. So if there's a lot of demand, then there's going to be shortage, and it will take time for the market to really become stable. Yeah.
Thank you, Dr. Tess. And Dr. Ulep, please.
Thank you, Ma'am Sheila, for inviting us again. I think my main takeaway here is, I think nabanggit din to ni Ma'am Tess, no, na there is no easy solution. And yung conceptual framework niya is very important, na yung mga mahirap na problema, mahirap siyang solusyonan, na hindi lang walang isang intervention na pwedeng maka-address nun. And that's also true for chronic malnutrition. No? I think we have a tendency as decision makers to look at one intervention, and that, let's say, spoon feeding, ganun lang. But based on experience, it's actually planning systematic, comprehensive approach talaga when you want to address chronic malnutrition. Like, honest to goodness, systematic, comprehensive solution yung kailangan. So I think yun yung main message, no, na kailangan nating matutunan when it comes to hard problems like inflation or chronic malnutrition.
Thank you, Dr. Ulep. Actually, Dr. Ulep is again our main resource speaker in our webinar this final week of October. So makikita ulit natin si Dr. Ulep sa October 26. Thanks again, Dr. Val Ulep. And finally, of course, last but not the least, Professor Giovanni Malab of MMSU. Sir, any final words?
Hey, good afternoon once again. Well, and at our end, in dealing with children, we should always be innovative. We don't need to be colossal in giving something new, but we need just to be. We just need to modify and give more appeal for them. Yun lang po ang pan namin.
Thank you very much. Friends, please join me in thanking all our speakers by giving them a big virtual clap. Maraming salamat ulit sa ating mga speakers, and also to Dr. Anado of the DLSU SRDC for her participation. If you have questions for her, I hope you left your questions in the Q&A box, and rest assured that those questions will be sent to her. Okay? So at this point, I now give the floor back to our MC, Zeki. Maraming salamat po ulit.
Thank you, Dr. Sheila, and to our distinguished speakers. Now, it's time to announce the lucky winners for our webinar raffles. For on Facebook, we have Mr. Amado Nunez Jr. and two Zoom participants, Ms. Carminda Pandel Carmen of Department of Science and Technology, and Oli Lucas of Unang Hakbang Foundation. Thank you. Our team will be in touch with you shortly to help you claim your prizes. And friends, before we finally close, I'd like to remind you that you can access all the presentations from today's webinar on the PIDS and SERPI websites. We value your feedback, so please take a moment to fill out the feedback form that you'll find on the screen and in the chat box. Your comments and suggestions are invaluable in helping us improve our future events. Stay connected with us. Regularly visit the PIDS website and follow us on Facebook, X, and YouTube. To access latest socioeconomic materials in the Philippines, visit the SERPI website and follow the SERPI page on Facebook, LinkedIn, and YouTube. And mark your calendars because we have one more exciting webinar for you this month titled Probing Healthcare Disparities, Trends, and Insights Based on PhilHealth 2018 to 2021 data. Join us on October 26 from 2 to 4:30 p.m. Finally, we'd like to extend our gratitude to various organizations from the government, embassy, academe, nonprofit sector, civil societies, business, and international organizations for their support. Building upon Dr. Orbeta's message earlier, let's unite our efforts to create a better future where the next generations inherit a country where food is accessible to all and where good health is enjoyed by everyone. Maraming salamat at mapagpalang hapon sa ating lahat.